According to the Centers for Disease Control, more than 1 million people in the United States are living with HIV infection, and almost 1 in 5 is unaware of their infection. We spoke to Dr. Eric Daar, Chief of HIV Medicine and a Principal Investigator at LA Biomed. We asked him to explain what AIDS and HIV is and the type of research that is being done at LA Biomed.
AIDS is actually a syndrome where people who are immunosuppressed develop any one of a number of complications. And HIV is the virus that causes the syndrome. It attacks the immune system, it weakens it, and it sets somebody up to develop AIDS. Our research is very much focused on what are the key issues related to HIV and AIDS in our patients. So a lot of the focus over the years has been trying to develop new and improved therapies to control the virus. And that's an area where we've been extremely successful. And while we're still working in that area, we've shifted our focus somewhat towards dealing with some of the people who are unable to access treatment. And it's not usually because of cost, it's usually because of many of the other issues they're dealing with in their lives. Psychiatric disease, homelessness, substance abuse. Trying to find those people and get them into care so they can benefit from the available therapy. And we're also trying to better understand what might be some of the long-term complications for those who are living successfully with HIV on antiretroviral treatment, or the anti-HIV drugs. What none of us really expected, although we all hoped 20 years ago, was that we'd be as successful as we have been in keeping people alive with HIV. That was the big focus for the longest time, Magic Johnson being a great example of somebody who's done extremely well on therapy, but he's not the exception. He's more the rule for people in care. But now that our patients are living longer, we find out that they may be at increased risk for other things that aren't specifically related to AIDS. So for example, there's reason to believe that patients with HIV infection, even when it's controlled on therapy, may be at increased risk for things like heart disease, kidney problems, problems with their liver. And we also know that HIV attacks the brain as well as the immune system. And we're increasingly concerned as to what may be the long-term consequences of HIV infection on the brain as we look towards our patients living literally 30, 40, 50 years with the virus.
Ralph Warner tells us how he has lived with HIV since 1984.
My CD4 counts were very high. When we finally were able to read viral loads, my viral load was very low. Finally, in 94, which was 10 years after I first was diagnosed, I started on medication. So I was very lucky that way. I had never been ill. I never had any one of those opportunistic infections. You have to have discipline. You have to take your meds as they're prescribed. You have to keep a regimen of exercise. Every morning I go borrow my next door neighbor's dog and I go for a long walk, and you gotta keep busy. I think you cannot let this illness run your life. You gotta run it yourself.
One important focus of our research now is to study those patients doing well on therapy. So we are collecting groups of people, putting them in what we call cohorts, and using pretty sophisticated technology to characterize what's going on in their body. So we're using specialized tests that look at brain function, that look at their bone density, look at their heart, and look at their kidneys and liver. And a big catchphrase now in medicine is inflammation. And it turns out inflammation is behind heart disease and lung disease. It probably contributes to cancer, and we now know it is contributing to some of these end organ effects of HIV, even when the virus is controlled on anti-HIV therapy. So we're trying to better characterize that, become clear on how inflammation may be causing those problems. And then even more importantly, once we do that, is try to understand why these patients still have increased levels of inflammation in their blood, despite the fact that they're on effective treatment. And once we do that, we can start to think about how to intervene. So we're in the very early stages trying to understand the problem, and then we need to get to what the underlying issues are, and then come up with novel strategies to treat it. And we're just starting to chip away with some early studies to try to see if we can do things to patients on therapy, doing well with their HIV disease, that might reduce these markers that we can measure in their blood of inflammation.